Should we sit?
Hi, Joy. All right.
You were going to do first or whatever. She's here whenever you're done with all this stuff.
Okay.
And
All right.
Joy's
Perfect.
here.
Enjoy section. Yeah, yeah. So we're good. We're set. Yeah. Yes. If you want to, we can get started.
Everybody,
We're gonna get started.
Get going. I want to obviously say good afternoon.
Good afternoon.
And welcome to Metabolic Medical Center.
And Jag Medical. Sorry, I didn't know that was my intro. yeah.
The Botox, bubbles, and B12 shots. I see a lot of people on the B12 shots, which is good. Anyway, we were thinking about doing this thing sort of as a grand opening. We started a relationship with these two and got very excited about what they could bring to the table, especially with a partnership for a spa. You know, we've done a lot of up in Columbia, but we hadn't done anything in the Charleston area. And we really wanted to find somebody who had a good backing, was good at what they do, had the same kind of basic philosophy that our physician does. And so all that seemed to really mix. And so we want, we're excited about that. We would, as I was saying, we were going to do a grand opening along with that, but unfortunately Meredith was around a young kid a couple of days ago. I don't know how many of you know, but there's a lot of kid stomach going around. And so she thought maybe she better stay out of here.
Yeah, thank you.
So, and so we really do miss her. She was going to be able to tell you a little bit more about Metabolic. But I think at this point what I'd like to do is turn it over to Jared and Ashton and let them pick up and tell you about the relationship that we're excited about. We're really excited about being able to provide it to our patients. We have a lot of patients that I think are going to appreciate this part, and I think we're going to have a really good partnership together.
Awesome. Well, thank you very much, Rick.
All right.
As I was saying, I'm Jared. This is Ashton. We've Jared Ashton Bouchard, so Jag Medical. I'm here just to kind of educate. This is probably a forum where I'm just going to talk about some of the services, the most common services that are around in aesthetics. I'll talk about the aging process, how we look at it, and then how we treat it, give a little bit of background, and then ask if you have any questions and about the services that we have. So when we look at the face, look at it in three compartments. You have the upper, middle, and lower compartment. When we're young, those compartments are filled nicely with bone, muscle, and fat. Unfortunately, as we age, that bone, that muscle, and that fat all breaks down. There's no immunity to it. It happens to everybody. Unfortunately, as those compartments narrow, that skin will start to fall and it creates fine lines and wrinkles. With those fine lines and wrinkles, it's really important to kind of define the different types. You treat them very differently. So the lines of dynamics are all those lines that you get with expression. So we tend to see a lot of those around the eyes. If you have kids or a husband, you probably get those anger lines right there, I'm sure. Yep, they kind of develop as soon as you get to that point. Forehead lines, crow's feet. We get some of those lines around our mouth as well. We tend to use or we treat those with neuromodulators. When I say neuromodulators, no one really knows what I'm talking about until I say Botox. Of course, everyone's a little bit more familiar with the name Botox. But neuromodulators is a category of medication. Botox is under it, Xeomin's under it, Dysport's under it, and Jeuveau's under it. If you've done it before, you probably have had one of those. All those medications do pretty much the same thing. They take those muscles of expression and soften those muscles so that those lines don't get deeper. We kind of preach that there is a little bit of a preventative aspect to that. If you can soften those muscles, prevent those lines from getting deeper over time, then it's going to take a little longer to develop those deeper lines. Still going to happen kind of regardless. And what we're really trying to prevent and what we really preach to our clients is that preventative aspect. I'm also in medicine. I'm always talking to my patients about preventative medicine. Like prevent those things from happening before they happen. As soon as it gets there, then you're going to be paying a little bit more. So those dynamic lines will eventually become what we call static lines, and static lines are there regardless of any expression. We tend to start seeing those under the eyes, see a lot of it around the nose and mouth, and a terrible name for it, but jowls. This is what we get a lot of people coming in and doing this. So just like I said at the beginning, that compartment narrows and falls really to treat static lines, and the only way to treat static lines is with filler, and filler is exactly what that name implies. You put something in that space and fill it up so it kind of rejuvenates that skin and makes it look more youthful. As far as services, there's a lot of other services. When it comes to fillers, there's a lot of different types of fillers. I won't kind of go into huge description, but there's a lot of there's replacement fillers and there's biostimulatory fillers, and I won't kind of go into too much detail unless you all have questions. A little bit. Okay, all right, well, I'll talk about it a little bit. Yeah, so when it comes to fillers, it's really, there's two kind of categories. There's replacement fillers, and that's exactly what they do. They just generally replace. That's the most commonly used filler, so your Juvederm and your Restylane line are replacement fillers. It just replaces that volume. You get an immediate effect. It lasts anywhere between 6 months and a year. Sometimes the manufacturer will say a little bit longer. We always say a little bit less, just because of expectations. But what it does is it just replaces that volume. It's a synthetic hyaluronic acid. And the way it works is like taking a dry sponge and putting it in a plate of water. It's really kind of thin and dry, but you put it on that plate of water and it kind of soaks up that fluid and kind of swells and looks, it has a lot more fluid in it. And that's how the replacement fillers work. You put it under the skin and it draws in that surrounding tissue, surrounds in that fluid, and you get that plumping effect and that more youthful effect. You know, the benefits are that there's an immediate reaction. You see it, so it's real time. So when we do lips or we do jaw lines, we do those things. We can fill one side, and you can look and you say, I want more. Oh, I want more. Or you say, that's good. All right, no, that's enough. All right. And then we move on to the next side. The other branch of it is biostimulatory fillers. It works on a little different properties. Radius, Sculptra are kind of those biostimulatory, and actually PDO threads are considered a biostimulatory. You may or may not have heard of PDO threads. So when it comes to biostimulatory fillers, you have a liquid, which are PRP, PRF. You may be familiar with that term. There's solid, which is those PDO threads, and then there's kind of that semi-solid, which is Radius and Sculptra. And those work in a little bit different mechanism. You put it underneath the skin, and it's not a replacement filler, but what it does is it replaces a little bit of volume, but it stimulates your own body's production of collagen and elastin by stimulating the fibroblasts. And so typically you don't see that immediate reaction. It's a little delayed because it's working on your own mechanisms, stimulating your own production. So you might see, 2-3 months down the line, a little or gradual improvement. So when we're talking with our clients, it's really important to say, are you instant gratification or are you okay with waiting a little bit? Because if someone's instant gratification, you do a biostimulatory filler, they may not be super impressed with that immediately. I tend to lean on biostimulatory fillers for multiple reasons. Once again, it uses the body's own mechanisms, which is nice, so the reaction to it is a little bit less, or adverse reaction, I should say. And it tends to last a little bit longer. So once again, using your own mechanisms. So it's a little bit more difficult when the body's producing and making that collagen. It doesn't break down as quickly as it does with replacement fillers. Cost, both of them are very effective. If you're really breaking down month per month and dollar to dollar, biostimulatory ones tend to be a little bit more affordable because they just last a little bit longer. So, any questions on that? Has anyone had any experience with those fillers or different types of fillers? So I see some hands here and there, but yeah. So the kind of the more basic things are your neuromodulator treatments, your Botox, Xeomin, Dysport, Jeuveau, and then fillers. But certainly there's a lot of other kind of maintenance therapies, and you can kind of treat some of these as maintenance or treatment, but your microneedling, your chemical peels, your daily care, we always really encourage daily care. So something that you do every single day, because once again, you're aging every single day and you're trying to combat that, right? So doing something to your face to combat that aging process every day is just as important. If you go 30, 40, 50 years without doing anything, you have a little bit of catching up to do. So, getting on a good regimen is super important. And so we, I probably shouldn't, but we don't promote any single product line, because that typically means you're going to be paying $500 for a package of stuff. That's really a flip of a coin of whether or not you're going to see improvement. So we tend to just make certain recommendations as far as ingredients. So, your retin-A's, retinols are really, really important as far as ingredients. Vitamin B has some medical backing. Vitamin C also has some clinical data behind it. So we usually kind of preach more ingredients and if you can get them. we also preach make sure you get the appropriate stuff, because vitamin C serums, typically, if you get them in a dropper or things like that, they don't tend to be as potent because it's an antioxidant, so it loses some of its potency in a dropper. So we always say try to get it in a vacuum pump, vacuum sealed, something along those lines. So just little tidbits. Like I said, we don't necessarily try to sell and make money off cosmetics or topical stuff. It should be stuff you're doing so that you're happy 10 years, 15 years down the line, that maybe when you look at your sister in your face, you have less lines and she has more, and you're like, all right, I'm doing something.
Like vitamin C, you don't sell that at all?
So we don't. So I will say this, I plug one company, and the reason is that when it comes to cosmetics in the United States, it's not FDA regulated. So it's really scary. Like, companies can put anything they want.
Can you say what company it is?
Yeah, Beauty Counter. So Beauty Counter is something that we promote. We don't really make money off it. We just kind of say, here's the link, kind of whatever. We have some recommendations, moisturizers, cleansers, things like that. But the nice thing that Beauty Counter has done, and this is kind of their, what their preaching point is that they eliminate 1,500 chemicals in their cosmetics. Europe has eliminated about 1,300. The United States has like 30, I think. Including lead, but I think they still allow a certain amount of lead to be in products, but still kind of terrible. So when we're doing things like lasering, microneedling, PDO threads, all that stuff, I want to make sure that when a client goes home that they're not putting something on that's going to inflame the face or cause some issues. And people say, oh, I use this product and use this product, and I like I've been using for years, but some of those products can cause micro-inflammation, and so it actually promotes aging. So there's really harsh chemicals, acids, alcohols and things like that that actually kind of promote micro-inflammation, and that's not a good consequence down the line. So Beauty Counter, like I said, we don't really like promote, but if you had to do, and I'll kind of step back, there's not much medical literature that shows that, like, cleanser, this cleanser, that cleanser, they don't really test them against each other, so to speak. So most all the products we use, I can say there's FDA approval for this reason, there's medical data, there's clinical data for this reason. For the cosmetic stuff, I kind of just say, if something you're interested in, do it. I don't have the medical backing saying like Beauty Counter's 100 times better than PCA or Eminence or any of those things. So I kind of leave that open. But the main thing is do it daily. Like I said, microneedling are great, both treatment and maintenance therapy. And so we have, like I said, a lot of kind of our services on there. Some of that stuff we do a lot of, but no one's really heard of. Like I said, PDO threads, kind of newer to this area. They've been around for a long time. PRP, PRF, things along those lines. Yeah, so any questions on any of those services? And I'm here all night, so keep questions. If you have a lot more questions, don't feel shy. Like I said, this is, when it comes to doing things on your face, you want to make sure that you're doing it right? So you don't want to like have something done that's either makes you look unnatural or causes something that to be worse. And so understanding, that's probably what we do a lot, is education. And we end up saying, you're not a good candidate for this on a lot of these different therapies, just because, once again, we want to make sure that our clients are happy long term and satisfied. So, all right. Anything from the crowd? All right. Cool. Well, we have a couple of spots for treatment today for just the neuromodulators. And then we have some spots on Saturday as well, if anyone's interested. We'll be here a couple times a month. We'll try to keep it consistent, but certainly you can come in for a consultation for any of these services. We're going to start adding more. We're starting off with the neuromodulators and fillers, but we'll get on with PRP, PRF, threads, and things along those lines. Cool. Well, thank you so much for being here. I really appreciate it.
Thank you.
All right.
What happens after I reach my goal weight? That's an excellent question. Once you reach your goal weight, most people don't know you're most susceptible to gaining the weight all back at that time, because your body has been in a reduced calorie state. So anytime you reach your goal weight, you want to immediately go into a maintenance plan. And research shows that you need to be in a maintenance plan for anywhere from 6 months to 2 years to really get your body in this new equilibrium that you've created for it. Also, this gives you enough time to really make those lifestyle changes that's needed to make lasting results.
No more fad diets or gimmicks, just healthy weight loss that you can finally feel great about. Going metabolic. Going metabolic.
What do I do when I have a craving? That's an excellent question and one that everybody faces. There are a few steps you can take to help you work through why you're having the craving and then, of course, what to do about it. Number one, ask yourself, am I hungry? A lot of times we get cravings for sweet and salty foods because we're simply hungry. And it may not be, we're sort of on the edge of hunger. Ask yourself, am I hungry? Number two, am I thirsty? A lot of times our body confuses thirst signals and hunger signals. Number three, is this just a habit? Do you find yourself having cravings at a certain time of day? For a lot of people, that's later at night when you're relaxing with your family or watching TV. You're accustomed to having a little bit of ice cream or popcorn or this and that. So there's different steps. One, ask yourself, am I hungry? If you're hungry, eat more healthy food. Don't go to the high fat or highly processed carbohydrates. Have some lean meats, have some veggies, and even a piece of fruit is a better choice than carbohydrate-laden foods. If you're thirsty, if it's hot outside, make sure you're drinking enough. 2 liters is a great benchmark for you to get every day for most people. And 3, if it's just a habit, change the habit, create a new habit. Have a conversation with a loved one, do some deep breathing or even maybe some stretching exercises before bed instead of your normal popcorn or ice cream.
No more fad diets or gimmicks, just healthy weight loss that you can finally feel great about. Going metabolic. Going metabolic.
I love our shakes for many reasons. One, they're a great source of lean protein. They taste great and they have all the vitamins and minerals you need to have successful weight loss. We've got a lot of different flavors and we also have some other things that aren't shakes.
Need to lose the quarantine 15? Fall back into a better self-care routine? Our proven physician-directed weight loss program can do just that. Come see us at Metabolic Medical Center. Buddy up with a friend. Make losing weight easier and more fun.
Chance to listen. If you don't want to listen, that's fine.
I just wanted to thank, we have a whole bunch of people here in the shops at Seaside Farms that offered to give us items to give away tonight for our grand opening. And I just want to thank all of them. It's JAG Medical Cosmetics, which we all know, and we want to thank them. Also Stagecoach, Seaside Pet and Spa, Tazi Bites and Blends, Illumia, Project Lean, Sylvia Salon and Spa, Crafty Drought, Vogue Nails, F45 Training, Izzy's Scoops and Sweets, Ardoa French Wine Bar, Basil, and Metabolic Medical Center.
Let me say this. We moved in here in February, and so I couldn't tell you how supportive these shop owners are. It's just amazing. They treated us the minute we came in here like we were their neighbors, and we just love being here. And you know, we spend all, like, you go to lunch and all that stuff. It's a wonderful, wonderful place. You know, it's just like they found we were doing this, and they said, "Yeah, let's give you some stuff. Give you some stuff." I mean, you know, truly advertising, but that wasn't it. I know, I could tell by the way they talk about the other people they met around here that it's really I never had a place somewhere about business like that. I mean, had that kind of thing going on. So anyway, you know, I thank them a lot. And we do business with everyone we can. So.
All right, I'm gonna give half of them away now. That's about 10, and then I'm gonna give the other half away in a little while right before we're over. So this first one is for Crafty Drought, which is down the road. They have all kinds of beer, wine, beer on tap, bottles of beer you can take home, all kinds of special things. So someone else want to draw the nose? All right, and the first winner is, and if they're not here, we'll have to hold on to it. It's Rhiann Chaplin. Is that person still here? Ryan or Rhiann? Ryan, maybe? No. Okay, well, she's got this one. All right. The next one is for Stagecoach. All right. All right. Stagecoach is Sarah Rosenthal. All right.
Thank you.
All right.
Cool.
All right. Next one is going to be for Tazi Bites and Blends. Okay, and it is Susan Lewis. Oh, that's me. All right. Make sure you let the partners know you came here and got it from us. All right, the next one is Vogue Nails and Spa. Elizabeth Rawl, she left. I knew that. All right. That's hers. Okay, the next one is for the pet store, Seaside Pets. All right, Ashley McNulty, or McAulty?
That's my friend. She's gone.
She already left? Okay, well, did she have a dog or a cat?
Dog.
She's got a dog. All right, there you go. Okay. All right, we have another one from Tazi Bites and Blends for Ashley again. Oh, because she bought something. Okay. She got an extra. All right, there you go.
You mean you buy something, you get extra?
Yeah, if you buy something, you get an extra card. All right, the next one is for the wine bar, Ardoa Wine Bar. Michelle Tumbleston. All right, let's find that one.
Got the right one on the show.
There you go. There you go. You're welcome. Okay, we have, next one is from the Lumia. And it's for Diana Hall. There you go. This is a really nice one. This is like the Turkish, like the blankets.
Oh, nice. Thank you.
Okay, the next one is from Project Lean. All right. All right, and it is Katie McGuire. Oh, yeah. Is she here?
She's coming, yeah, she's coming. She's spinning right now.
Okay, we have two more. The next one is from Metabolic Medical Center. And it's for Joy. Joy. You did it. This one. Oh, my. Joy, this one for you. All right, you guys are going to walk up here.
I usually will spin around a little bit later.
Okay, and then one more that is from Jag Medical Cosmetics. And it is Donna Megger. Oh, all right, there you go. And you got one for Joe. All right, there you go. All right. All right, that's the first round, and so we'll have a little more in a little while. Thank you guys very much.
All right, so one. All right, did Pilar announce that we're going to do a demonstration?
You need this, Chad?
No, we should be good. If you haven't had it done, we're going to do a demonstration just so you can kind of see our methods. It's a little bit different than some clinics. So we're going to have Joy, our model, come up.
Yep. I have that baby back there. I Yes, sorry. We'll make sure
Okay, I'm going to turn this up. It was 16 and 22. So we'll do a little demonstration for everyone who's in the back. If you haven't seen or had Botox, now's the time to see it done. Okay. All right. Oh, thank you, yeah. All right, Joe, I'm just gonna clean. So start off with cleaning the area that we're going to treat. We're going to treat both in between the eyes, the forehead, and crow's. So if you have a lot of makeup on, sometimes it will come off, but Joy does not. All right. So next, it's really important when you're looking at someone's face. The muscles of the face are not much different than muscles of the body. So if you have 10 people in a room, someone may have more muscles in their legs, more muscles in their chest, more muscles in their arms, so on and so forth. Face is very similar. You're going to have some muscles that are more bulky kind of between the eyes in the frontalis region or the forehead and around the eyes. And so it's important not to treat every client the same. Now, when I go through a patient, I'm going to have them make some expressions and kind of observe the bulkiness or the movement of their muscles. All right, so I always have a client. We always do before and after photos as well, but we have befores of Joy when she first came in, and we have afters as well. So she's had it done before. She's a client of ours. Yeah. So she trusted us. What was it, a week before your wedding, or a couple weeks before?
It was a week before.
A week before the wedding. First time she ever had it done, she came in and she's like, "I have a wedding in a week," and we were like, "All right, let's do this." It turned out wonderful.
Is it true? Sorry. Is it
No.
true that like if you get it, the more you get it, you don't have to get it as much?
Yeah, so that's a great point and a great question. So once again, these medications are going to take a bulky muscle and kind of soften it. So those muscle fibers aren't going to be as strong. So usually the first time you come in, you're going to require a little bit more to get that muscle kind of debulked, so to speak. Over a subsequent visit or two, if you stay on top of it every, say, 4 to 6 months, if you kind of stay on top of it, and that's what we tell our clients, try to stay, whether it's with us or someone else, try to stay on top of it every 4 to 6 months. That way it prevents that muscle from getting bulky again and then be able to create those lines. So we have clients that say, "Oh, I haven't gotten in a year." So when they come in, I can see that those muscles have already gotten stronger. So I tell them, we're going to have to treat you a little bit more, because otherwise they're like, "Well, I only got 30 units last time. Why are you treating me with 38? Well, the reason is that muscle's kind of gotten that bulkiness back, so we have to kind of get it set back. And that's super important, especially when you're doing the masseters too, because that's a bigger muscle. So when we're kind of shaping the jawline, we have to kind of stay on top of that to keep that muscle softer. Well, there's a couple of reasons for it, or a couple of therapies. People who have bruxism or grind their teeth, their masseters are really, really strong. And some people just genetically, and particularly females, you want that idea of that jawline is more V-shaped. But genetically, when your masseters are strong, or say, for whatever reason, it kind of gives you more of a square shape. We can actually shape that jawline a little bit to make it more of a V. Like I said, for today, we're going to do kind of between the eyes, the more common areas that are treated. And so, like I said, the muscles of the body, not too much different than the muscles of the face. There's always a muscle that works against another one. So for example, my bicep will curl my arm, my tricep will extend my arm. if I have a dominant muscle one side or the other, it's going to push or pull more in that direction. So when it comes to the face, same thing. You have this glabellar complex that pulls everything down. So when I have Joy look angry, it pulls those eyebrows down. But you also have a muscle that combats that called the frontalis, and it pulls everything up. And so one thing when we're treating clients, we are a little bit more conservative with the forehead because one of the bad outcomes from getting neuromodulators treatments, if you treat too heavily in that forehead, you can get heavy. You can get a heaviness, which is very uncomfortable for 3 months to 6 months. And so we go very conservative the first time we treat anybody. It's a lot easier to add a product than it is to take it away. So when we initially see someone, I'll underestimate the forehead. And then if it works out for you, awesome. If you have any movement, we have you come back and we'll treat you for free, and then we kind of know what your dosing is. Also clients, there's kind of two groups of clients. There's clients that come in and say, I want it natural, I want to still have some movement. Okay, great. We have some that are like, I want to be frozen. Like, I don't want any movement. And so, once again, kind of getting that understanding of what the goal is super important, because then my treatment's going to be different. So I'm going to have Joy look angry. And so right here, she does have some pull. A lot less than when we were treating back in the day. But this muscle right here tends to be really strong in most clients. It's called the procerus, and then you have the corrugators here that tend to be pretty strong. So I'll do a little dot in those areas that I'm going to treat. Sometimes I'll go a little bit more laterally. So once again, everyone's musculature is a little bit different. There's some who genetically have a much more lateral muscle pull, and so it's important to see. Most of hers is more medial. It doesn't go any further than the pupil. But we have some clients that come in and their pull's all the way over here. And it's just because genetically, for whatever reason, those muscle fibers are just located in a different area. They still do the similar movement, but you just have to make sure you notice that. I'm going to have her raise her eyebrows. Perfect. So once again, the bulk of the muscle in the frontalis is here, but I'm assessing every single patient differently because majority of clients, their frontalis ends here, but there's about 20% of the population where the frontalis actually attaches a little bit lower. And you probably heard of the Spock eye. If you've been doing this or whatever, sometimes you can get that Spock eye where one corner of the eye shoots up after you get treated. I can't say I've never done that. If you've been doing Botox and Xeomin long enough, you're going to have that happen. But part of that assessment is to make sure that frontalis doesn't go that far, because if I don't treat it, then this gets soft, but this lateral portion stays up. And you kind of have like what we call a Spock eye. Now, some clients love that, so they'll be like, yeah, exactly. So once again, if a client says, I got it one time in my eyebrow, I loved it, so then we kind of know what to do.
The first time I got it, it did that. But it did it here, and
kind of in the middle.
It lifted my eyebrow.
Right, and that's a good, yeah, and that's a great point. That's a great point. So kind of if someone comes in, they just want an eyebrow lift, then certainly I can kind of adjust the medication accordingly. So once again, I said that push and pull system. So if I want an eyebrow lift, I'm going to treat these muscles more heavily, treat this one lighter so that there's a natural little lift. Now, the data out there shows you can get maybe a millimeter, up to 3 millimeters elevation with Botox, Xeomin, Dysport, and Jeuveau. It doesn't sound like a lot, but when you're kind of putting makeup on, every millimeter counts. So a lot of our clients, so it does make a difference. So raise your eyebrows again. Perfect. Okay, good. And then crow's feet, so I'm going to have you smile. Very good. So crow's feet come in two different flavors. You have kind of superior crow's feet that are on the higher portion of the eye, and then you have inferior crows. Mine tend to be on the inferior side. We're getting a lot of clients in because now with masks, we're all smiling with our eyes a lot more. So we're getting a lot of people coming in getting crow's feet treated. So the thing with kind of lower crow's feet, a little bit difficult to treat. We still do on a kind of a lower dose or a microscopic dose or a micro dose. The reason is because multiple muscles create these lines. And you have to be careful. One of those is the zygomatic muscle, and if you treat if an injector doesn't know what they're doing, they can go too deep and it will drop your cheek. So you can have a bad outcome there. And so we tend to stick up more superiorly, and if we do go in the inferior portion, we just do a very light dosing. So that's also important. And we say that because, once again, when clients come in, it's all about that expectation. If I say I can completely eliminate every single crow's feet, I'm not doing you any service if I either drop a cheek or you don't get that result that you're looking for. All right, and big smile again. I can usually tell what side somebody sleeps on just based on their crow's feet. Big smile for me. So, and do you sleep on the right? Yes, more on the left, yeah. But, and the reason being is when you sleep on one side for 15, 20 years, it's not like the pillow's causing you to age faster. It's just that you're aging differently, and you spend 8 hours a day on one side, it's just going to age that side differently. I cannot sleep on my back. I've even tried stacking pillows and everything like that, but we always kind of encourage to sleep on your back or something along those lines so you don't have that. Okay, any question about this process so far? Yes, ma'am.
Are you using Botox?
So we're going to do Xeomin today.
What's your dilution ratio?
So we do 2.5 mLs per 100 unit vial. That's usually the recommendation for both Xeomin and Botox. Some, once again, everyone kind of treats things a little bit differently. What you don't want is someone to do more because it dilutes it down, makes it weaker. So the recommendation is 2.5, so we stick with that. You can do less, and it just makes it a little bit more concentrated, a little bit stronger. But we stick to the 2.5. But that's an interesting question. I've never had that asked before. Why?
I was an injector in Ohio.
Oh, okay.
I started doing my injections a long time ago, and she always did a 1-to-1.
1-to-1, yeah. With Botox or with?
Botox.
Botox, yeah.
And that's really all that works for me. And like I've just had 57 units of Botox, and I still have
some movement.
Are there static lines that you can't get rid of?
So static lines, yes, there are several areas of the face where you can't get rid of static lines. Some will argue you can never completely get rid of static lines. So even if you come in, you have static lines, and I put filler, you may still see a little faint line. So typically when we talk with clients is if we're going to fill a line with a filler and charge you that syringe, we want to make sure it's a significant static line. And so you'll see significant improvement, but it doesn't completely eliminate it because you're still going to have some of that volume loss. And other things, and then some of it is that tissue is then imprinted, and there's some fibrous bridges that form with the layers of the skin. And we've had some clients that have very deep. We had some slideshows up here that we weren't able to project, but very deep creases, genetically speaking. And we actually have to go in and break up that fibrous tissue with a needle. And so we actually come in and I kind of break that up with just a plain needle and try to break it up. So no amount of filler is going to fix that static line. I have to kind of break up that fibrous tissue. Yeah, so there's an aggressive way, which is a straight needle, or you can do microneedling. Sometimes the microneedling in the face will help break up some of that fibrous tissue.
So she's probably 29 and I'm 63 almost. So
I love it. I love it. Do you want to? Yeah, yeah.
there's going to be a lot of difference in what we would get.
Yeah. So of course, age, and then. So you age in 10 different ways, right? So when someone comes in, they've never had anything done before. I'm not going to correct those 10 different ways in 50 years in one treatment. What we don't do here is we'll add this, we'll add this, we'll add this, add this, and do 6 or 7 things at once. What we try to do is it's kind of like a good weight loss program. If you're not having a healthy relationship with that food, then it's not going to make much of a difference. And so we try to create a healthy relationship with your skin. So sunscreen, daily care, all these things that make a big difference. And smoking is a big thing with us too. So we have a client that comes in and smokes and they want all these lines and stuff fixed. They're going to burn through that filler so fast. I tell them it's not worth your money. Like even if you're willing to pay me, you're not going to be happy with the results, and it's going to make us look bad. So we actually have on our disclaimer thing, if you smoke and you still, understand it could be, gone in a couple months. And it's not to pat ourselves on the back, but once again, it's being very selective about who you're treating, because this whole business is all about expectations. And if we're saying, hey, do 5 things at once and pay $6,000, $7,000, your expectations are going to be here, because you could have just spent $8,000 on a facelift, and so those are kind of, you're absolutely right. Every client's different, and there's some clients that we just say, I'm sorry, but we can't really do much for you, because at some point the Botox or the Xeomin, this sport's not going to help. At some point you're going to have to get 9 or 10 syringes of filler, and that's way too much. That's not going to look natural. And so you have to have a point where you just say, boundaries. We say in this business, you have to have some boundaries and say, sorry. But Joy is not in that boat. She's been a client for a very long time, so we appreciate her. So any questions on this process as far as the dotting? The dotting doesn't represent a dose, it just represents an area of injection. We kind of talk about the dose beforehand. One thing we also do is tell you the dose, tell you how much before we even get started. This is always a conversation that's really important, because the thing that's I've experienced this where you go up to the front and they're like, it's $600, and you're like, oh crap, no one told me that. You already got it done, so what do you do? So there's always those times as being up front, like this is how much it's going to be, because a lot of clients will be like, oh, all right, well, let me plan on next month or something like that. So we always talk about kind of units, the cost and everything moving forward. We get the thumbs up, and then we move forward. Okay? So I've already cleaned, I've dotted. I'm going to go ahead and inject. We had a filled syringe here. Yeah. So with her movement, when she looks angry and upset, she's got a little bit of movement here, not as much as she did before. So in her case, she's kind of stayed on top of it. So originally we did 22 units in the glabellar region. I think we did 22 in the frontalis as well. But now we're kind of weaning that down. So we're doing 16 in the glabellar. We're going to do 12 in the frontalis. I got 2, 4, 6 on each crow's. Okay, and once again, you know, with all our clients that we initially inject, we try to be conservative, because if I'm telling you to come in every 4 to 6 months, I don't want to charge you an extra 10 to 15 units each time. I'd rather you take those 10 to 15 units and use it on another treatment, because you're going to be much happier if you do stay on top of it. There's nothing out there, there's no medication you can buy over the counter that can prevent lines and wrinkles like the neuromodulators do. All right. And this is a very small needle. Even if you have some kind of needle allergy, it's just a 30 gauge, it's very small. You feel a little pinch here. Look angry for me again. Perfect, and relax. She's got a little bit more. All right. So like I said, just little pinches. As far as, and I always tell our clients afterwards, kind of what you're looking for. So I always say be able to sit up for the next 4 to 6 hours. The biggest risk of this is the movement, and in the first 4 to 6 hours, you can kind of move that product with enough pressure. So meaning, there used to be a thing called Botox parties where people would just go and drink. And the biggest thing was they'd drink and they'd pass out on something on their arm and move the Botox. And so that was the big thing. We always tell our clients, try to avoid drinking, try to avoid passing out on your arm. You can drink as long as it's in moderation, but upright for the next 4 to 6 hours. Avoid any strenuous exercise activity that's constantly like swooping or bouncing. And then light pressure. After tonight, tomorrow morning, you can kind of go back to your normal activities. There's typically not much in the signs, as far as maybe an hour you'll have little kind of outpouchings, or we call these little bug bites, and then they go away. The one thing is crow's feet, you have a big venous complex right on the edge of the crow's feet, so sometimes you can get a vein and it causes a little bit of a bruise. But for the most part, you don't get much bruising when it's when you're doing Botox and Zeman. All right, and that's that.
I have a quick question. Like, how do you decide, like, whether it's Dysport or Botox, or you just look at the
Yeah,
person?
no, that's a great question. So At some point, at least in our clinic, we couldn't carry all 4 lines. There's a cost effectiveness to it. The product, at least we abide by what their recommendations are. As soon as you open it, you have about 48 hours to use it. And so, when we had all available, we were losing a lot of product because we wouldn't use this vial in 48 hours, this vial. So we finally just decided, all right, we got to stick with just a couple. So fortunately, unfortunately, Botox is the biggest name. So when everyone hears Botox, they call you, can you do Botox? Yes, so we have Botox, and we keep Botox around for actually a lot of reasons. It's FDA approved for migraines. It's FDA approved for hyperhidrosis, which is excessive sweating, contracture. So we use it for other reasons. It's FDA approved for those reasons. And then the other one we went with, because we like their other lines, is Xeomin, and Murrells has their line. So the nice thing about Xeomin, which we really like, is A, it's a great company. They're not as big name, so we can kind of get a little better pricing on that product. And we feel that it works the same as Botox. So we get the same duration, we get the same. There might be, if you look at the literature as far as units to units, Botox and Xeomin are kind of 1-to-1. It's like 1.2 to Xeomin to 1 unit Botox. Dysport works on a completely higher unit scale. So you're looking at 3 units per 1 unit of Botox. Dysport can sometimes get a little bit, I don't want to say pricey, but the theory behind Dysport was this faster onset. So the client we get in that's like, I got a wedding in 3 days, 4 days. We say, well, you're not going to have any results by then. So sorry, but Dysport in theory has a faster onset, and so you can treat someone and have it kick in a little bit faster. Love the product. I have absolutely nothing in it. Where I think I was talking to somebody about it, that it's a great product. But like I said, at some point you can't carry everything.
How do you choose which one? Like if your client comes in and they're like, which one should I have?
Sure. So it's like Coke and Pepsi. Some clients are like, I love Coke or I love Botox. Like I don't want anything else in my skin other than Botox, and that's fine. So we have it. If someone's willing to try something or price is an issue, then we say, okay, we'll do Xeomin. One thing I do tell our clients, though, the way we inject, the conservative approach, is that means about 20% of our clients, we're going to still have some movement. We've calculated about 20% still have some movement after that week or two. We have you come back, we treat you for free, because once again, I'm trying to aim for that lowest dose that gets you the results you want. That way you're not spending extra money. And the nice thing about once we kind of know your dosing and things like that, then we know it. The next time you come in, we can kind of adjust from there. But if someone doesn't have a huge preference and price is an issue, then we'll go with Xeomin. So yeah, there's not, like I said, some people know, and they'll come in, they'll ask for Dysport, and we tell them, we don't have it, and they're like, okay, and they move on because they believe that, and that's fine, But I can't say that there's no head-to-head studies to answer your question. There's no medical literature that says Dysport's superior to Xeomin or Xeomin's better than the rest. It's really just kind of, all of them I think work great, to be honest with you. So. Oh yeah.
I have a guilty question because I totally don't know anything yet, so that's fine.
Yeah. No dopey questions.
I'm trying to watch this. But so if you get something done, and then it fades away, does it move your face more?
So that was always a big question and a big, false narrative or wives' tale, so to speak. If you stayed on Botox, that once you stopped, it aged you faster. There's a lot of things at play.
About building muscle, but was that with something else?
Yeah, so fillers are so it's kind of a difference between the neuromodulators and fillers. The neuromodulators like Botox, Xeomin, and Botox, Xeomin, Dysport, as opposed to a filler, correct. So what can happen, like I said, with the masseters, some people come in and that masseter is thick. It's really, really thick. And so there are times when we treat it and that masseter goes down, you might get what we call volume loss. So there is some truth that you might get a little sagging because that massive muscle that was taking up this much tissue is now a little bit smaller. And we explain that to our clients. A lot of the clients who come in are younger, so that skin will rebound. But if they're older and that skin isn't going to rebound, then I'll talk to them about it and say, we may actually need to build up your jawline with a filler. And we can do that easily with any kind of either replacement filler or the biostimulatory filler, where we can build up that jawline and replace that volume that's been lost. Similar, not as much so, because the muscles of the face aren't as bulky as some of the bigger muscles of the face. But if we have a client who comes in and that muscle is really, really bulky, over time it does lose a little bit of volume. But the improvement they get with those lines, it kind of, you know, makes up for it, so to speak.
So would you do like a Botox first, and then when it goes volume loss
Mm-hmm.
or whatever, you would do filler?
Do a filler, absolutely. And so, you know, when you look online about fillers, probably the first 5 things you'll see are pictures of people's faces like dissolved, or, you know, like craziness, like Google does whenever you Google anything. Most of those areas that we used to, there were no-no zones, were kind of in this area of fillers, and because there's an artery that runs right through this area. So you had to be really, really careful when you filled this area. The other area is kind of in this area, once again, big artery. Wherever there's an artery, it was always kind of a no-no zone. But we kind of changed the techniques. There's a lot of development in the past couple of years in aesthetics as far as how to inject and what to inject with, and techniques that are very technical. I keep saying techniques, but it's very technical. That you can actually apply fillers here and do different things, like the biostimulatory fillers, PRF, PRP, PDO threads, that now allow us to fill this and put volume here. When we used to just have replacement fillers, that's all we really had. It could be dangerous because you could hit that artery. But if I'm drawing, the PRP and PRF is your blood. I draw your blood, I spin it down, I get basically a filler out of it. It's your own blood product. And so when I place it here, if I get an artery, it's your own blood product. It's not going to occlude, it's not going to cause any issues.
This isn't like some other chemical. You draw my blood, which
Right.
is a nightmare. Apparently. Come to find out, I guess.
It looks like you have good veins. I definitely could get...
Well, on the hand. Oh yeah, now I've been educated.
Yeah.
That I don't do the arms.
It's the hands.
I have it from when I was a child.
Yeah.
It's the nightmare. But so you would take my blood and then you would do something like, would I have to come back a week later because you have to process it or something?
No, and I'm not sure how much of this is legal to say on camera, so we might have to edit. But I can draw your blood, and in everyone's blood there's growth factors, and those growth factors include fibroblast growth factor, they include vessel growth factor, epithelial growth factor. And to some degree we all have, everyone's familiar with the term stem cells. To some degree we have undifferentiated cells in our blood, but it doesn't get isolated or concentrated to the face. And so what we can actually do, and this has been, the nice thing is with all these techniques that we have, it's not like just we woke up in a garage one day and decided to do this. All these techniques that I'm talking to you about with the threads, with the PRP, PRF has been used in medicine for a very long time, but it's been used in different areas of medicine. So PRP, PRF, the blood draw, it was used in orthopedics. So when you strained your knee and you got ligament damage or tendon damage, the blood flow to that area is reduced. And so you're not going to heal very well, as opposed to soft tissue like a muscle or skin. If I cut my skin, it heals pretty quickly. If I strain my tendon, it takes a long time. And so someone much smarter than me says, well, why is that the case? Well, the skin gets a lot more blood flow. Muscle gets a lot more blood flow. So they said, well, why don't we just draw some blood, separate what's in the blood, not the red blood cells so much, but the growth factors or healing factors, and inject it back in the knee. Lo and behold, athletes were getting back on the field faster, and it was healing them. So there's a lot of orthopedics offices that do PRP treatment. So then someone was, again, smarter than myself, said, well, if it heals ligaments, tendons, and all that stuff, why don't we inject it in the face and see what it does? Lo and behold, it showed an improvement, collagen, elastin, fine lines, wrinkles, all those things. And so PRP, PRF, the only difference is that when you draw it, the PRP is, there's an anticoagulant, so there's no clots that form. And the PRF, there is no anticoagulant, so it can still form a clot. And this is really kind of, there's a lot of detail, but the nice thing about having some of that clot formation, the downside is you only have about 15 minutes to use it. So if it's going to be something that I need to like do really, really, really quick, I'm not going to go that modality. But if I'm doing like a spot here or in between, then I can kind of do it, put it in there, and we're good. That clot, what it does is it holds onto those growth factors and delivers them slowly over time, as opposed to PRP, which doesn't have an anticoagulant, so it hits you really hard with those growth factors really quickly, and then it dissipates. And so really what they found is that the improvement or the better outcome is slowly delivering those growth factors, so it's stimulated over time as opposed to a quick burst of it. So you can use those, it's your own blood product, so I can now take that.
Within 15 minutes, you're take the blood and then do your little bit focus.
Yeah.
And then write like 10 minutes.
Yeah, I mean, it sounds like it's magic. We do it all the time.
I'm happy with the
Yeah, yeah.
This is great.
No, it's a fabulous technique. Like I said, we're leaning. It used to be replacement fillers is really what we did a lot of, but now we're actually able to use clients' blood products as a.
Sounds good to me.
Yeah. And
I
the
don't need immediate. I just want to look.
yeah, and so that would be. Yeah. Now, once again, it's not like you're 45 or whatever, and we put it on your skin and suddenly you're 25. But it certainly does use more natural products and things. And we have clients that they, for either religious reasons or personal reasons, they don't want to use a replacement filler because it's a synthetic hyaluronic acid. So they just don't want to do that. They want to go more natural. So this is a perfect example of someone that we do. We do a lot of infusion with different biostimulating filler. And like I said, those threads. So the PDO thread is very kind of newer here. It's been around for a long, long time. And like I said, it's a perfect example of something that's been used for like 50, 60 years in surgery. It's just a dissolvable suture that they've used in surgery. So perfect. Yeah. So what they found is. We do threads all the time. I've done threads. It's a great system. And so you just take we didn't bring any examples, but it's just on a small needle. It's about 1 inch, and they just kind of wrap that thread and they tie it down with an anchor. And then I can place that needle underneath there, release that ankle underneath the skin. So just superficially underneath the skin. Now there's smooth threads and there's barbed threads. The barbed threads, we're talking about facelift and all that stuff. Bye y'all, thank y'all for coming. It's a pleasure meeting you. Oh yeah, okay, absolutely. So, yeah. So yesterday we did a PDO thread facelift and neck lift, and it's gorgeous. Looks great. Yeah. So it basically it's not free, but it's
the most expensive.
I wouldn't say it's the most expensive when considering if I have a client comes in and they have a lot of sagging, it's probably going to take about 3 or 4 syringes of filler to get any kind of like decent lift. Okay. So by the time you pay for 3 or 4 syringes of filler, you've already covered the cost of thread lift. So, like I said, yesterday we did it. We got great results. Yeah. So once again, when the manufacturers, you look it up. If you look up PDO thread lift, yeah, they'll tell you 3 to 5 years. I always cut that down to about maybe 2 years, 3 years.
Now, does it help me maintain what I have? I mean, or once it dissolves, I'm going to go.
Yeah, another great question. So when they were actually researching this, when the pathologists kind of like doing slides and looking at this in patients that had surgeries that involved dissolvable sutures, they found that the body replaced it with type 1 collagen. So that's the same collagen that we make in our face that we want, that keeps our youthfulness. And so someone, once again, smarter than me, said, why don't we take little bits of this and put it underneath the face skin? And lo and behold, they did, and it's called a smooth thread, and it created collagen. And what it does is it takes that surface skin, that crepiness, and that kind of like, I don't know how else to explain it, but it's like crepey skin. You can actually place those threads, and it smooths that skin out. And it works in a way of a biostimulatory effect. So you basically put that thread there, the body recognizes it, breaks it down, and replaces it with a collagen core, and it smooths out that skin.
I have another ridiculous. I'm sorry, I'm just totally new.
So we don't.
So like with the threads, like do they do the little threads in the boobies come up?
You can do a lift. You can do a butt lift. You can do a slight lift. It's not going to be to the degree of a surgical one. We treat a lot of décolleté lines, those kind of the crepey lines in the neck. We treat a lot of necks because you get that kind of saggingness. As far as butt lifts and chest lifts, to be honest with you, I haven't done enough of them to kind of see if there's a huge difference in that. There's literature out there, but a lot of times with those clients, I say probably best to go to a surgeon and get that worked on. So, yeah, and I apologize. You've had a couple questions raised here.
So when you're saying fillers, you don't mean Juvederm and Covella and all
So when kind of like, and I'm always one that does categories. So neuromodulators is that category of medications that includes Botox, Dysport, ZMN, Jeuveau. fillers is a broad category, but you can break that up into replacement fillers or biostimulatory fillers. All of them in some degree will fill that space. Right. Yeah. And those are all replacement fillers, a typical hyaluronic acid.
So that's not what you're talking about,
Right.
though. You're talking about the blood thing.
Yeah.
And that would take place of those?
Yeah, it would replace those fillers and kind of use your own body's mechanism. The thing is, and once again, I somewhat explained this, is those replacement fillers give you immediate gratification. If you come in for cheeks and you use replacement filler, you walk out there and you're like, I love it, I love it, I love it for like 3 or 4 months, and then it starts coming down and you're like, I need more. And that's how replacement fillers work. Biostimulatory ones, it just takes a little while to kind of like kick in. If you're not a very patient person, it can be frustrating because you're like, I don't see the change, I don't see it, but it takes a little time to kind of see it.
What, like a week or a month?
About 2 months. It stimulates collagen and elastin production for about 2-month time frame.
Well, and if you're using a good product, you know.
Yeah. We really like it, but I know we kind of got off track a little bit. We got our tracks set up here so patiently. You're doing great. Any questions about the injections, anything, if you want to ask Joy about her experience, you can ask her. We always have some clients who always ask about the pain level. As far as pain, you know, she can kind of explain it's very minimal. You get a little pinch here or there, but as you can see, no significant bleeding. She has little bumps that where she got injected, but otherwise. All right, so awesome. If you have any other questions, I'll stick around. I know we're actually going to, I apologize, we have some that are waiting to get Botox and Xeomin right now, but if there's any other questions about these services, please let us know or reach out to us. We have Instagram, Facebook, emails, multiple phone numbers. You can track us down and we'll get back to you. All right, awesome. Thank you so much. All right. Yeah, great job. Thank you, Joy. A round of applause for Joy. Yeah. I'll go ahead and get Susan. Are you okay with waiting? Did you get the sign?
Are you ready? I have some hats and hats, a little lantern.
Do you want to come on back?
Okay, cool. Random guy, you know?
What happens after I reach my goal weight? That's an excellent question. Once you reach your goal weight, most people don't know you're most susceptible to gaining the weight all back at that time because your body has been in a reduced calorie state. So anytime you reach your goal weight, you want to immediately go into a maintenance plan. And research shows that you need to be in a maintenance plan for anywhere from 6 months to 2 years to really get your body in this new equilibrium that you've created for it. Also, this gives you enough time to really make those lifestyle changes that's needed to make lasting results.
No more fad diets or gimmicks, just healthy weight loss that you can finally feel great about.
Going metabolic. Going metabolic.
What do I do when I have a craving? That's an excellent question and one that everybody faces. There are a few steps you can take to help you work through why you're having the craving and then of course what to do about it. Number one, ask yourself, am I hungry? A lot of times we get cravings for sweet and salty foods because we're simply hungry. And it may not be, we're sort of on the edge of hunger. Ask yourself, am I hungry? Number two, am I thirsty? A lot of times Our body confuses thirst signals and hunger signals. Number 3, is this just a habit? Do you find yourself having cravings at a certain time of day? For a lot of people, that's later at night when you're relaxing with your family or watching TV. You're accustomed to having a little bit of ice cream or popcorn or this and that. So there's different steps. 1, ask yourself, am I hungry? If you're hungry, eat more healthy food. Don't go to the high fat or highly processed carbohydrates. Have some lean meats, have some veggies, and even a piece of fruit is a better choice than carbohydrate-laden foods. If you're thirsty, if it's hot outside, make sure you're drinking enough. 2 liters is a great benchmark for you to get every day for most people. And 3, if it's just a habit, change the habit, create a new habit. Have a conversation with a loved one, do some deep breathing, or even maybe some stretching exercises before bed instead of your normal popcorn or ice cream.
No more fad diets or gimmicks, just healthy weight loss that you can finally feel great about.
Going metabolic. Going metabolic.
I love our shakes for many reasons. 1, they're a great source of lean protein. They taste great and they have all the vitamins and minerals you need to have successful weight loss. We've got a lot of different flavors, and we also have some other things that aren't shakes. We have soups, we have oatmeal, and so that's a great variety for people to try. The thing about the shakes having the lean protein is they have a lot of good protein that will help keep you full over a long period of time without any added fat or carbohydrates that really adds the unnecessary calories. And it's always important to make sure you're getting enough vitamins and minerals during the weight loss. And our shakes are specially formulated with all the vitamins and minerals you will need during the weight loss process versus something that you may find in the grocery store.
Weight loss always looks great, but at the end of the day, the real prize, the real present is your health.
Going metabolic. Going metabolic.
Hi, I'm Farah with another edition of Step Up to the Plate. Did you know that onions were often placed in the tombs of pharaohs as they were believed to promote prosperity in the afterlife? Well, I don't know about that, but what I can tell you is that onions contain fiber and folic acid. Folic acid is a B vitamin that helps the body to make healthy new cells. Onions help fight cancer and osteoporosis. And they're a great source of biotin, which gives us healthier and stronger hair, skin, and nails.
How do I get my significant other to lose weight? I found the best way to get your partner, wife, husband, or significant other to lose weight is to be a great example for them. They may not at first be supportive, but if you are consistent and persistent with your goals and they see you day after day making the healthier choice, walking, drinking water, maybe saying no to a little extra alcohol, they eventually will respect your choices and in some case will even get on board to support you later.
Did you know that tomatoes are the state vegetable for New Jersey, but the state fruit for Ohio? And that China is the largest producer of tomatoes? Tomatoes are rich in lycopene. That is an antioxidant and is good for the heart and packed with vitamins A and C, calcium, and potassium. Tomatoes lower your risk of heart disease and certain cancers. People love to eat them raw, but cooked tomatoes are actually better for you than raw ones because they release more beneficial chemicals.
What happens after I reach my goal weight? That's an excellent question. Once you reach your goal weight, most people don't know you're most susceptible to gaining the weight all back at that time because your body has been in a reduced calorie state. So anytime you reach your goal weight, you want to immediately go into a maintenance plan. And research shows that you need to be in a maintenance plan for anywhere from 6 months to 2 years to really get your body in this new equilibrium that you've created for it. Also, this gives you enough time to really make those lifestyle changes that's needed to make lasting results.